What if I told you there is a peptide that focuses almost exclusively on fat loss and has virtually no side effect on blood sugar, and it's not a fat burner, it's not a stimulant, and it's not another overhyped supplement? Hey guys, I'm Jay Patel, a PA here at MyFitMed. I have over 10 years of experience with peptide therapy, and today we are diving into AOD 9604, what many are calling the most promising targeted fat loss peptide in the modern medicine. You have probably seen those stubborn fat areas that just don't respond no matter how perfect your diet is or how hard you train. We all have them. Those generic problem spots that seem immune to conventional approaches. Imagine having a compound that could specifically target this area, clinically shown to help mobilize fat that has been essentially locked away from your body's normal fat burning processes. This isn't science fiction, it's AOD 9604. And if you have been struggling with weight loss plateau or stubborn body fat despite doing everything right, this video might just change the way your entire weight loss approaches. Here is what's different. Unlike other compound that promises fat loss but affect your entire system, AOD 9604 was specifically engineered to isolate the fat-burning properties of human growth hormone without any of those growth-promising or blood sugar effects. So here is the list of what we'll discuss today and what you will learn today in this video about AOD 9604. Whether you are struggling with those last 10 pounds, trying to break through a frustrating plateau, or dealing with stubborn fat that is resistant to diet and exercise, you need to understand how this revolutionary peptide is changing the weight loss landscape. So if you're ready to discover one of the most targeted approaches to fat loss available today, let's get into it. So what exactly is AOD 9604? Let's break this down in a simple term. AOD 9604 stands for anti-obesity drug 9604. It's modified fragment of human growth hormone, specifically amino acid 176191 of the growth hormone peptide. This is the specific region of growth hormone responsible for fat metabolism. Think of it this way. Scientists essentially isolated just the fat-burning piece of the growth hormone puzzle while leaving out all the other effects. What makes this so revolutionary is that the traditional human growth hormone affects multiple processes in your body, from cell growth and reproduction to blood sugar regulation. This broader impact is why many people are cautious about using the full HGH therapy. AOD 9604 was specifically designed to target only the fat metabolism aspect of growth hormone. The research team led by Professor Frank Ng at University of Australia created this peptide with the goal of delivering the fat loss benefit without the unwanted side effect of full HGH therapy. This selective action is what makes AOD 9604 such an interesting compound for those focused specifically on body composition and stubborn fat reduction. AOD has been through a significant clinical testing. In fact, it received the FDA investigational new drug status, meaning it was deemed safe enough for human clinical trials. It's also received generally recognized as safe status for use in food products in United States. What truly sets AOD apart is its mechanism. Unlike traditional fat burners that typically works by stimulating your nervous system to increase energy expenditure, AOD 9604 actually helps liberate fat from the areas where it traditionally been difficult to lose. Think of a stubborn fat like it's locked into a vault that your body has limited access to. AOD 9604 essentially helps unlock the vault, making the fat available for your body to use as an energy. Now let's get into the fascinating science of how AOD 9604 actually works in your body. I'll keep this straightforward while giving you the information you need to understand its true power. So AOD 9604 works primarily by binding to beta-3 adrenergic receptor on a fat cell. These receptors are particularly concentrated in an area of a stubborn fat like lower abdominal fat for men and hip and thigh fat for women. When AOD 9604 activates these receptors, it triggers a process called lipolysis, the breakdown of stored fat into the free fatty acid and glycerol, which can then be used by your body for energy. What's particularly interesting is that AOD appears more effective at mobilizing the fat from the area that are typically resistant to diet and exercise. These are the areas where the fat cell has a different ratio of alpha and beta receptors, making them more resistant to normal fat burning signals. Beyond just liberating stored fat, AOD has 3 additional mechanisms that makes it particularly effective. First, it reduces the new fat accumulation by inhibiting lipogenesis, the process of creating new fat cell. This creates two-pronged approach, releasing stored fat while preventing new fat storage. Second, research suggests that AOD can enhance the fat burning process itself through increasing the thermogenesis, literally turning up your body's calorie burning furnace. Third, and perhaps the most important for a long-term result, AOD doesn't negatively impact insulin sensitivity or blood glucose level. This is crucial because many weight loss compounds can actually make your body less responsive to insulin over time, creating a metabolic environment that promotes fat storage. In fact, some research suggests that AOD may actually have a mild beneficial effect on glucose metabolism, though this isn't its primary mechanism. Another fascinating aspect of AOD is that unlike full growth hormone, it doesn't stimulate IGF-1 production in the liver. This selective action is what allows AOD to deliver targeted fat loss benefit without the broader systemic effect that causes concern with traditional growth hormone use. Let's talk about what most people are excited about. AOD's ability to target stubborn fat area that seems resistant to diet and exercise. First, let's address the elephant in the room, spot reduction. The idea that you can lose fat from specific area by targeting them with exercise has been largely debunked by scientific research. However, what makes AOD so interesting is that it works with your body's natural fat burning mechanism. It helps overcome the biological resistance that certain fat deposits have to mobilization. You see, not all fat cells are created equal. Some area of your body, typically those stubborn spots, have fat cells with the higher ratio of alpha-2 receptor to beta receptors. Alpha-2 receptor essentially act as a locks on the fat cell, making them resistant to mobilization. These areas tend to be genetically determined and includes lower abdominal fat in men, hip and thigh fat in women, lower back fat, in some cases under chin fat deposit. AOD appears to work particularly well with this area because it can help override the normal resistance these fat cells have to releasing that stored energy. In my practice, we have observed that patients typically notice changes first in their traditionally stubborn fat area when using AOD as part of their comprehensive approach. This is completely different pattern than what we see with the diet and exercise alone, when these areas are usually the last to respond. What's important to understand is that AOD doesn't magically dissolve fat. It makes stubborn fat more available to your body's natural fat burning processes. This means you still need to be in a calorie deficit for optimal results. Think of it this way. Diet and exercise create the demand for energy, while AOD helps ensure that the energy comes from those stubborn fat stored that would otherwise be resistant to mobilization. In clinical studies, researchers have found that AOD administration resulted in significant reduction in body fat percentage compared to placebo group, with effects particularly pronounced in midsection, exactly where many people struggles the most. The research suggests that AOD is more effective when you are already following a solid nutritional plan. You are engaging in regular physical exercise, specifically strength training. You are specifically targeting stubborn fat that hasn't responded to traditional approaches. This makes AOD an excellent tool for those who are already doing the right thing but have hit a plateau or struggle with genetically stubborn areas. Beyond just fat loss, let's talk about how AOD can contribute to overall body composition, the ratio of fat to lean mass that ultimately determines how you look, feel, and perform. One of the most significant advantages of AOD over the other fat loss compound is that it's selective. Many traditional fat burners or even medication can lead to loss of both fat and muscle tissue, which is counterproductive for most people's goal. Remember, losing weight isn't the same as losing fat. True body composition improvement means preserving or even increasing lean muscle tissue while reducing the fat mass. Unlike full growth hormone, which can promote both muscle growth and fat loss, AOD focuses almost exclusively on fat metabolism. However, this selective approach actually creates an environment that can be protective of lean muscle when in calorie deficit. By enhancing fat metabolism from stubborn areas, AOD helps ensure that more of your body's energy needs during a calorie deficit comes from the fat store rather than breaking down the muscle tissue. This is particularly valuable for athletes training to make weight class without losing performance, physique competitor during the contest preparation, anyone wanting to improve their body composition without sacrificing the hard-earned muscle. This is ideal for improving your body composition. In my clinical experience, patients using AOD during the fat loss phase typically maintain more strength and muscle fullness compared to traditional calorie restriction alone. Another interesting aspect of AOD's effect on fat distribution pattern. Many people notice that their fat loss becomes more proportional and aesthetically balanced when using this peptide, rather than losing from some areas while stubborn spot remains unchanged. This more harmonious fat reduction can create more dramatic visual changes than what the scale might suggest, which is why we always recommend tracking your progress with pictures and measurement rather than just the body weight. For the best body composition results, AOD seems to work optimally when combined with the moderate calorie deficit, not extreme dieting, regular resistant training to maintain muscle tissue, adequate protein intake, at least 0.8 to 1 gram per pound of lean muscle mass, strategic timing around workout for enhanced mobilization. Now let's address how AOD can affect your metabolism and performance, areas that are often overlooked but crucial for long-term success. Unlike stimulant-based fat burner, that temporarily increases energy expenditure but often lead to adaptation that reduces their effectiveness over time, AOD works with your body's natural fat burning system. One of the most interesting findings from the research is that AOD may help regulate the activity of an enzyme called hormone sensitive lipase, which plays a key role in breaking down stored fat. This is significant because HSL activity often decreases with age and after long period of dieting, making fat loss progressive more difficult. Exactly what many people experience as they hit the plateau. Another metabolic benefit is that AOD doesn't appear to trigger the same degree of adaptive metabolic slowdown that typically occurs with the calorie restriction. This could help prevent the frustrating rebound effect many people experience after losing weight. From a performance perspective, enhanced fat mobilization means greater access to your body's most abundant energy source during a low intensity activity. This is particularly beneficial for those endurance athletes who rely heavily on the fat oxidation, anyone doing fasted training to enhance metabolic flexibility, and those incorporating zone 2 or low intensity steady state cardio for fat loss. Many users report improved endurance and greater ease maintaining steady state activity, likely due to enhanced availability of fatty acid as a fuel source. For those doing high intensity interval training or HIIT training, the enhanced fat mobilization from AOD can be particularly synergetic. The peptide helps liberate stored fat while the high intensity activity creates the metabolic demand to utilize that fat. From a practical standpoint, many users notices better energy level during calorie restriction, less pronounced hunger when dieting, improved workout performance when in a deficit, more consistent energy throughout the day. This benefit likely stems from the more efficient fat mobilization and utilization, providing a more stable energy source than the blood sugar fluctuation many experience during a calorie restriction. Let's talk about how AOD is typically dosed and administered for optimal results based on clinical experience and research protocol. AOD is most commonly administered as a sub-Q injection, meaning into the fatty layer just beneath the skin. This is similar to how diabetics inject insulin and uses a very small, virtually painless needle. The technique is straightforward. Pinch an inch of skin, insert the small insulin needle at about 45-degree angle and slowly inject the solution. You can inject in the abdominal area, avoiding navel area, and into the front of the thigh. As for the dosage, this should always be determined by a qualified healthcare provider based on your individual needs and medical history. However, typical therapeutic range for AOD 9604 are between 300 to 500 microgram per dose. AOD generally can be administered once or twice daily. While some practitioners recommend injecting near the targeted stubborn fat area, the research on whether this provides any additional localized effect is inconclusive. So I usually don't recommend the localized fat injection. Now, some important administration consideration. AOD 9604 should ideally be taken on an empty stomach. For maximum fat burning effect, it can be taken right before the fasted cardio. Store reconstituted AOD into the refrigerator. Visible particle or cloudiness in a solution indicate it should not be used. In my practice, I usually recommend dosing one time a day. It can be early morning empty stomach, right before fasted cardio, or right before you go to bed. Idea is to inject on an empty stomach. The duration of therapy varies by individuals and goals, but many protocol ranges from 8 to 12 weeks, followed by an assessment of the results. I usually recommend about 3 months protocol and then taking it off after 3 months. But we also discuss at the end of the 3 months, see how their results are and what the next step is. It's worth noting that result typically begins appearing after 2 to 3 weeks of consistent use, with more pronounced effect accumulating over the full course of therapy. Usually after 3 months, depending on the goal, I also recommend some combination therapy. For monitoring results, I recommend weekly photos under consistent lighting condition, body composition measurement via machines like in-body scan. This is what we use in the clinic, or even DEXA scan if it's available. Circumference measurement of waist and problem area. Tracking markers of metabolic health like fasting, glucose, lipid profile, and also vitamins and hormones doing a regular labs. One thing I cannot stress enough that AOD, like other peptides, should be obtained through legitimate medical channel. Quality and purity are the paramount for both safety and efficacy. Now let's talk about some of the most effective ways to enhance AOD 9604 benefit by combining it with complementary peptide. While AOD is powerful on its own, certain peptide combination can create synergetic effect that amplifies the result or provide additional benefit beyond what any single peptide can deliver. The most common and evidence-supported combination is AOD with GLP-1 receptor agonists like semaglutide and tirzepatide. This pairing is particularly powerful because they work through completely different mechanisms. AOD enhances fat mobilization and breakdown, whereas GLP agonist reduces appetite and slows gastric emptying. Together, they addresses both sides of energy balance equation, helping you consume fewer calories while more effectively utilizing the stored fat, especially from the stubborn fat area, for energy. Now, for those specifically focused on stubborn abdominal fat, combining AOD with Sermorelin can be remarkably effective. Sermorelin has been FDA approved for reducing visceral adipose tissue and works through different mechanism than AOD 9604. Now, by targeting both sub-Q fat with AOD and visceral fat with Sermorelin, this combination can create more comprehensive abdominal definition and metabolic health improvement. Another effective combination pairs AOD with MOTC, a mitochondrial-derived peptide that enhances cellular energy production and a glucose metabolism. This combination can be particularly beneficial for enhanced exercise performance during calorie restriction, improved insulin sensitivity, and greater overall metabolic flexibility. Now, for those focused on both fat loss and muscle prevention, adding ipamorelin CJC1295 to AOD can provide broader benefit. AOD focuses on fat mobilization, whereas ipamorelin CJC supports growth hormone release for recovery and tissue repair. When combining peptides, dosage typically need adjustment under medical supervision. Each additional peptide introduces a new variable and potential interaction. Now, based on my clinical experience, I find that most patients can achieve excellent results with AOD alone before even considering more advanced protocol. Adding combination should be thoughtful progression based on specific goal in response to the initial therapy. On a final note on combination, the peptide I have mentioned works throughout a different mechanism and generally doesn't compete with each other at the receptor site. This is why they can create a true synergetic effect rather than just additive benefits. Before considering AOD or any peptide therapy, it is critical to understand the potential side effect and situation where this compound might not be appropriate. The good news is that AOD generally has a favorable side effect profile compared to many weight loss medication or full growth hormone. This is largely due to its focused mechanism targeting only the fat burning aspect of growth hormone. The common side effect of AOD 9604 may include redness or irritation at the injection site, typically mild and temporary. Transient water retention, particularly when beginning the therapy. Headache in some individuals, often related to hydration status. Temporarily joint discomfort, less common compared to the complete HGH therapy. And some of the sensitive individuals may complain about nausea since it has to be injected empty stomach. Most of these effects are mild and transient, typically resolving within the first few weeks of treatment as your body adjusts. However, AOD 9604 is not appropriate for everyone. So the contraindication to AOD includes pregnancy or breastfeeding, active cancer, uncontrolled diabetes, though AOD has less impact on blood glucose than a full growth hormone. Individual under 18 whose growth plate haven't closed. Additionally, while AOD has less impact on insulin sensitivity than full growth hormone, those with diabetic or insulin resistance should have appropriate medical monitoring if using this peptide. This is why proper medical screening before starting therapy is absolutely essential. A qualified provider will review your medical history, current medication, and may order a specific lab work to ensure that AOD is safe for you. I want to emphasize that while AOD has an excellent safety profile in research to date, all medical intervention carries some degree of risk. The key is ensuring that potential benefit outweighs those risks for your specific situation. It's also worth noting that AOD is not replacement for foundational health habit. It works best when combined with a proper nutritional plan, regular physical activity, specifically weight training, adequate hydration, and the most important, proper sleep hygiene for very good recovery. So we have covered a lot about AOD 9604 today, from its unique mechanism targeting stubborn fat to practical aspect of administration and potential combinations. Now, to summarize what we have learned about AOD 960, it is a modified fragment of human growth hormone that focuses specifically on fat metabolism. It works by enhancing lipolysis, particularly in stubborn fat area, resistance to diet and exercise. Unlike full growth hormone, it doesn't affect IGF-1 or significantly impact blood glucose. It can be particularly effective for addressing a plateau and genetically stubborn fat deposit. When combined with other peptides, its effect can be significantly amplified. What I find most fascinating about AOD is that it represents a more targeted approach to body composition, working with your body's natural processes rather than forcing weight loss through stimulants or extreme calorie restrictions. So in my practice, I have seen remarkable transformation, not just in the physical appearance, but in how patients relate to their bodies and their approach to health. Many report that finally addressing those stubborn areas that wouldn't respond to conventional method was a game changer for their confidence and motivation. If you found this information valuable, please support the channel by liking this video, subscribing, and hitting that notification bell to stay up to date on future content about cutting-edge therapy for body composition and performance. In the comments below, let me know what other peptides you would like me to cover in future videos. Your questions directly shapes the content I create. This is Jay Patel, certified PA, dedicated to helping you optimize your body composition, enhance your performance, and live the most confident life. Thank you for watching, and I'll see you in the next video.